Okay, thank you. Chair recognizes Mr. Garcia.
Thank you. Thank you, Mr. Chairman. And I do want to appreciate the work of the GAO. I think there's incredible work that happens there. And of course, a lot of uncovering of waste, fraud, and abuse happens. Mr. Dodaro, I want to thank you for your important testimony. I agree there is absolutely a responsibility for us to look at ways of reducing the deficit to actually make government more efficient. And I think that while I served as mayor before coming to this committee, we worked really hard with our auditor, with our state auditor to do just that. And so thank you for being here. So Mr. Dodaro, I do have some simple yes or no questions for you, which I think are important. Mr. Dodaro, do you believe that the recently firing of promoted federal workers who are therefore on probationary status does anything to solve the important problems that you've raised today? Yes or no?
Well, I agreed to, was sworn to tell the whole truth, nothing but the truth, and the whole truth sometimes doesn't get reduced to a yes or no answer. And so in that case, I think it's important to look at what functions were being provided and what was done in those cases. But it's important that the rules be followed, that there's certain personnel requirements and rules.
Would you say yes or no?
I would say that, and the question was whether it would solve any of the problems that we identified on the high-risk list, and the answer to that question would be it's doubtful.
Exactly, and I agree with you. I agree. It would be a no. Now, what about has the GAO recommendation ever included firing FAA aircraft safety inspectors who repair air traffic control facilities?
No.
No, I agree. Has the GAO ever made any recommendation on firing USDA animal and plant health inspection service workers who were tracking the bird flu outbreak or other outbreaks in poultry or cattle?
I do not believe so, no.
Thank you. That's a no. Has the GAO recommended firing National Nuclear Security Administration workers who oversee our nation's nuclear stockpile?
No.
What about firing the only locksmith at Yosemite National Park? Has the GAO ever recommended that?
I'm not sure we've ever run into the locksmith at the park.
And the answer to that is you have not.
Right.
And so I thank you for that because, of course, these none of these have ever actually aligned with any of the recommendations that have come out of your office, but yet they are clearly huge priorities for Elon Musk and his Doge team. It's obviously a crusade against the government, against actually helping people across this country. And it's the hypocrisy that we're seeing today and in our committees that I think is quite disturbing to House Democrats. Now, Republican colleagues have spent a lot of time warning about unsustainable deficits. We know that today there is a huge vote, of course, we know, on a budget. Their budget version and bill has a $4.5 trillion tax cut giveaway, essentially, when we should be asking the super rich to actually pay more. And at the center of this, we know, is a huge cut to Medicaid. They're targeting at least $880 billion, maybe more, in Medicaid cuts. Now, in my district alone, we have 300,000 people that are dependent on Medicaid approximately, which is a huge amount of the community and the district. Now, nationally, 80 million people we know are on Medicaid, but it actually impacts every single district across the country. Whether you're talking about Kentucky's 1st District, where 26.5% of the population there, 155,000 people are dependent on Medicaid. Whether it's in Ohio's 4th District, over 100,000 people depend on Medicaid. That's 15% of the population. Whether it's in Louisiana's 3rd District, 196,000, almost 200,000 people dependent on Medicaid. Or in Georgia's 14th District, where 109,000 people, or 16% of the population, are dependent on Medicaid. We know that Medicaid saves lives. These are huge numbers of people. These are folks that are colleagues of ours on the other side of the aisle that are members of this committee and that oftentimes are here at this committee. So this actually has an impact to our constituents. It means elderly and disabled people won't get their health care, their long-term care. It actually impacts people that have real substance abuse issues. And one other thing that people don't realize about Medicaid, there's a lot of conversation in this country about births and encouraging people to have more children. Medicaid covers 41% of all births in our country. 41% of U.S. births were paid for by Medicaid. And so if this is really about supporting families and about expanding families, we should also be talking about supporting and expanding Medicaid coverage for Americans. We should be providing more coverage, not less. And so with that, I want to thank you again for your work, and I'm hopeful there are enough Republicans in today's vote will do the right thing and avoid these Medicaid cuts. With that, I yield back.
Gentleman yields back. Chair recognizes Ms. Green.
Thank you, Mr. Chairman. Thank you for being here today, Mr.